What if your parents or your grandparents had to choose between paying for groceries or filling a prescription? What happens if they get sick but can't afford to see a doctor? Or imagine this, after a lifetime of hard work, you're finally ready to retire. But now you're on your own when it comes to healthcare. No more employer sponsored health insurance, right? Now you're on a fixed income and you have to try to pay for it all on your own. Think about what would that feel like? What if the very system designed to prevent you from choosing between a roof over your head or the medication you need to stay alive started to disappear? Well, that system is Medicare. It's been around for nearly 60 years. It's changed the lives of millions and millions of Americans for the better. But right now, it's under a lot of pressure financially, politically, ideologically. So, how did we get here, right? What's going on with it? And why does this matter to everybody? It should matter to everybody. Medicare is a federal insurance program that primarily serves people 65 and older, along with some other younger, severely disabled folks. It was signed into law in 1965, and honestly, it was a game changer because before Medicare existed, about half of all seniors had no health insurance. Imagine reaching retirement age and suddenly being on the hook for every hospital visit, every doctor's visit, every medical emergency. Everything had to come out of your pocket. Medicare changed all that. It gave millions of Americans peace of mind, access to care, and the ability to age with dignity. And today, over 65 million people rely on it. And here's the thing, Medicare isn't just some safety net, it's also, a hot topic right now in politics. It's not perfect. There's coverage gaps, rising costs, and growing concerns about its long term future. The program is under constant pressure from both parties. For different reasons, of course. Some want to expand it, others want to cut it. And some are pushing to privatize large portions of it altogether. So, with that, I want to welcome you to Evergreen Perspective. I'm Ben Chrisley. I started this podcast to have honest, grounded conversations about issues shaping our lives, not only just here in the Pacific Northwest, but across the country. A little bit about me, I'm a Navy veteran, a flight nurse with over 20 years of healthcare experience, small business owner, business founder, and a CEO. I'm a running and triathlon coach, youth football coach, an endurance athlete who's competed in ultra trail races up to 200 miles and full Ironman triathlons. I bring all of that lived experience into the work I do, including this podcast. I believe that facts matter. I believe in listening and seeking understanding across different perspectives and cutting through the noise to focus on what's real, what actually affects people, real people, hardworking American people that work every day to provide and to survive. I don't follow a blind ideology just because a political party or a religion says I should. I lead with people in mind, period. That means putting all humans first, regardless of gender, race, sex, age, religion, sexual orientation, identity, or political affiliation. Because if we can start with humanity, we can start actually solving problems. This isn't about left versus right or anything else. So, in this episode, we're going to dive deep. We're going to look at how Medicare came to be, why it was created, and who made it happen. We'll talk about early backlash, how doctors, insurance companies, and Ronald Reagan tried to stop it. A young Ronald Reagan. Or unpacked how Medicare works today, the parts, the private insurance, the gaps, the challenges people face when they fall through these gaps. And then we'll talk about the threats, the budget cuts, the calls to reform or privatize, and who really benefits when those changes happen. And finally, we're going to look ahead. What would it take to keep Medicare strong for the next generation and the generation after that? What reforms could actually help? And what should we be paying attention to as voters in the political arena? Because Medicare isn't about some line item on a federal budget. It's a lifeline for millions of people. And the decisions being made about it affect everybody, whether you're 25, 45, 75. So, let's get into it.